We distinguish between non-inferiority and superiority clinical trials and interpreted clinical and surrogate endpoints used in NI trials. We also looked at internal validity of non-inferiority trials. Now, given a non-inferiority clinical trial, let's evaluate its external validity.
So external validity will basically looking at generalizability of the study. So we still ask the same questions as we would ask when we evaluate superiority studies. So you want to make sure these patients are similar to our patients. We want to make sure that patient important outcomes were included in study. And something that's important about non-inferiority is that because occasionally some your intervention could be a little worse than the standard treatment, but not too much worse. In other words, not more than the non-inferiority margin. This might be something to discuss to the patient because the patient really needs to know the actual numbers. Like if we say like you know for example, if you're talking about heart attacks, you can say so this drug will cause a little more heart attack, but not too much more. The patient may not be comfortable receiving a drug that's non-inferior to the standard treatment. So shared decision making is something that's important in modern medicine, and what shared decision making means is that uh, you know uh, uh, the patient should be included in the decision making. In other words, the physicians, the pharmacists, and also the patients should be included in the discussion when a treatment is selected for the patient, so that they know all the risks and benefits, and they can have a saying. Especially when it comes to patient preferences. That would be some important factors when choosing a treatment that's non-inferior to a standard of care. This concludes this presentation on non-inferiority trials.